Welcome back. Are we seeing signs of the fifth wave of COVID-19 infections? Well, the latest numbers are in, and there are 4,631 new cases, representing a 17.8% positivity rate. Let's discuss this with Dr Aslam Dasoo from the Progressive Health Forum. Doctor, thanks for your time. We appreciate it. So 17.8% positivity rate. Does that mean we're edging closer to a fifth wave in South Africa?
Good evening, Shahan. Good to be with you. Yes, I think it does. There is a strong suspicion among those who are closely observing the trends that we may be at the beginning of the expected fifth wave.
And what should we watch out for in South Africa in terms of how concerned we should be? Because I know we expected infections to increase, but now that we have, 45% of the adult population vaccinated and population immunity, the thing to watch out for, I'm guessing, is hospitalizations and deaths.
Sure. So we're at an interesting point in the pandemic. You will have observed that during the fourth wave, the one caused by the Omicron variant, there was a distinct decoupling between the number of reported cases and the number of people who got severely ill or died, as compared to the previous waves. Indeed, during the Delta wave, which accounted for 50% of all the fatalities during the pandemic, during the Omicron wave, it's only about 5 to 7% of all the fatalities. And this gives the impression that we may be entering the new phase of the pandemic. Now, obviously, one swallow doesn't make a summer, and we must wait for how this fifth wave manifests to determine if there is a trend that the Omicron wave started. Given that we don't have any news yet of any new variant of concern, and that we have identified sublineages of the existing Omicron variant, which may be driving these numbers we are seeing today, the view is that the fifth wave will not be any worse and may even be less severe than the fourth wave. If that should turn out to be the case, then, as they say, the trend is your friend, and we may be then on the cusp of pivoting out of the emergency phase of the pandemic during 2022.
And just in terms of what's happening in other parts of the world, Shanghai, for example, where they're tightening the enforcement of lockdown restrictions, people are being evacuated from buildings so they can disinfect them, etc. That's obviously causing panic for some people when they look at things like that. How worried should we be that eventually we're going to see the same thing in South Africa?
I think the Chinese situation is quite unique. They have a zero COVID policy, which means that should even one case emerge, they will pull out all the stops and put in every measure they think is necessary to stop the rise in cases. That being said, of course, they've had quite a steep rise in cases. And, as you mentioned at the outset, we have just over 40% of our population now vaccinated, but we do have up to 90%, which is the number that most of the scientists are talking about, having some level of immunity, which means that the majority of people in South Africa did obtain immunity even without vaccination through natural infection. Of course, we paid a terrible price for that because those who survived being naturally infected, came from the group which has, of course, the highest number of severe disease manifestation and deaths. And so, it did cost us a lot, but the population is fairly immune at the moment. I don't think we are going to see a situation that we are seeing in China and in certain other parts of the world, even with the advent of the fifth wave. I think the vaccination, however, has to be increased dramatically, because even if we are dealing with sublineages of Omicron, there are people who are going to get sick. And of that, there will always be a proportion who get very ill and who die. And so we do need to be vaccinated. If you are vaccinated and you've been naturally infected, you're practically bulletproof for a given wave. However, our vaccination program has somewhat stalled. And this is a matter of grave concern. We have sufficient amounts of vaccine in stock, but people are not coming forward. Now we have to question our approach to vaccination. Of course, there's always the argument that there's a lot of anti-vax sentiment about, but we had that during the HIV/AIDS pandemic, where there was a lot of denial. Actually add to our vaccine basket to get more people vaccinated. I think this is going to be a very crucial step. The fifth wave will probably not be our last. We may get a sixth wave. There may be a variant that emerges that, gives us a sucker punch. We don't know, but it's highly unlikely. The only way to manage that is to protect ourselves. So protect yourself by getting vaccinated and just do the common sense things. We've said that we're all pandemic veterans now. We know what to do to keep ourselves safe. So do so. There's no harm in that. But we don't need to shut down society. We don't need to shut down economic activity, certainly not now. And I doubt we will need to do that even during the next wave. If I may add one more thing, we are entering the winter period where typically we get the flu season emerging, and we have an annual epidemic of influenza, and that many people, take a shot for. In the last 2 years, we've had a very low incidence of it, mainly because we've been locked down, we've been protecting ourselves with masks and avoiding and closing schools, which are a high incidence of spread occurs there, and so on. So we have an immunity gap, and the worry is that this year's flu epidemic will be much more severe. And one very concerning thing is that the research has now demonstrated that co-infection with influenza and with COVID has a more than 2 times higher incidence of needing mechanical ventilation in ICU. So it's very serious if co-infection occurs. So the idea is also to get a flu vaccine as soon as you can. And you can take that simultaneously with any booster that you may be due to take. But do so as soon as you can. This wave is beginning, and we will watch it, and you will all get the numbers, I'm sure. And we are likely to go through a period of some difficulty over the next couple of months.
Yeah. I just want to talk to you a bit more about this flu that is pretty scary from what I've heard, because I went for a flu vaccine just yesterday, in fact, and the nurse there was telling me about what they've witnessed in terms of how people are getting infected. So can you take the flu vaccine and your COVID-19 vaccine or booster at the same time, or do you need to wait a certain period of time?
It's always best to stagger, but that's just for conventional reasons. There's no problem in taking the influenza vaccine and the COVID vaccine simultaneously. And I think right now, if you have difficulty in, staggering those doses, you should just take your shots, because time is running out and we are entering a wave. And the big worry, as I said, is to prevent co-infection, because that just results in a terrible situation.
And going forward, in terms of all of the, and this is not with the worst case scenario, because, none of us want any mutation of COVID any further. We've been through enough. Just in terms of the patterns in South Africa, and we know that the regulations were supposed to end at the end of April in terms of what's in place, and government's going to reassess and tell us on what's the way forward. The one thing that's irritating lots of people is the use of masks, regardless of whether it's outdoors or indoors. Would we be at the end of April into May ready for that position where we can say, actually, it's okay, we don't have to wear masks as a mandatory thing?
All right. So, over the last couple of years, we've learned a lot. The first thing we've learned is that masks work. Now, of course, there must be the proper masks worn properly, but they do work. And, even if you take an average 50% of eliminating transmission with masks, that's 50% less chance of someone else getting sick or of you getting sick. So it definitely works. How it works is important. We have an illness that's spread by aerosol. It's like spraying an air freshener in a corner of a room. You'll smell it in the other end of the room pretty quickly. So if you're outside, that won't happen. And that's simply because aerosol disperses very quickly in the open air. And that is why the recommendation is that you need not wear a mask when you're outside. However, indoors, especially in crowded public spaces, it's always wiser to wear a mask. We are moving into the winter months, and there's going to be a lot of indoor congregation now. And I don't think, we're at a point where we can say we don't need masks anymore. That would just be absurd. I think to be prudent, wear a mask, a proper mask, a medical grade mask, not a cloth mask. That's like wearing nothing. And maintain, hand hygiene and just the common sense approaches that we do. Don't get into a crowd where people are unmasked, where you don't know them and don't know whether they may be carrying the bug. So it's going to require a lot of personal responsibility, I would put it like that, and including getting yourself vaccinated, because you may well get infected even if you're fully vaccinated, but you'll suffer the sniffles, flu-like illness, but no worse. And I think that's worth it, in anybody's books. So masks indoors, in crowded public spaces, I would say it should be mandatory, and I don't know if it is still, but I think we should make it personally mandatory.
Yeah, thank you so much for your time and your insight. Always a pleasure talking to you. Dr. Aslam Dasoo from the Progressive Health Forum.